Good day, students! Heads up! We'll be learning new stuff for today. The procedure of urine pregnancy test. But first of all, I'm going to introduce myself to each and every one of you. My name is Sabra of BSN 2-1, and I will be your guide through Nursing 107, the care of mother, child, and adolescent. So what time is it? It's time for learning! For today, we're going to learn the procedure on how to perform a urine pregnancy test and on how we're going to communicate with our client. But first, what is a pregnancy test? Pregnancy tests are based on the detection of the human chorionic gonadotropin or the HCG, which is seen in the urine as a probable sign of pregnancy. Human chorionic gonadotropin or HCG is produced by the placenta shortly after fertilization and reaches a detectable level in the urine and serum for about 1 week after implantation of the early embryo to the uterine lining. The purpose of pregnancy test is to determine the presence of human chorionic gonadotropin in the client's urine, which is a probable sign of pregnancy. The materials needed to perform this are the following: pregnancy test kit, specimen bottle, and medical gloves. The specimen we're going to use is a urine, preferably the first morning urine, as it gives us a more concentrated level of cellular elements. As a nurse, we must be taking consideration for the following before we proceed to the actual procedure. First, explain the procedure to the client. Second is provide privacy. And third, to always communicate with a smile. We must also assess the following before doing the pregnancy test procedure. First is the level of consciousness of the client. Second is the absence of menstruation. Third is the last menstrual period. And fourth is the expiration and integrity of the pregnancy test kit. Begin communicating with the client first by identifying the correct patient, introducing yourself to the patient, and explaining the procedure. Good day, ma'am. I am Sabra, your nurse who will be accommodating your care for today's clinical visit. May I know your name and age? Yes, good day too. My name is Mrs. Smith and I am 32 years old. Alright, Mrs. Smith, we're going to do a pregnancy test procedure for today to see if you're probably carrying a child. Assist the client to go to the bathroom. Instruct the client to collect a clean catch in midstream urine. Instruct by saying, Mrs. Smith, we'll be needing you to wash your private area before collecting a clean midstream catch of urine in a specimen bottle. Then after this, you secure the specimen collected. Perform hand hygiene and wear gloves. Read the instruction of the pregnancy test kit carefully. After placing the pregnancy test kit in the examination table with a dropper, aspirate 2 to 3 drops of urine in the indicator area. Wait for a couple of minutes depending on the pregnancy test kit instruction. Result may vary into positive pregnancy, negative pregnancy, or invalid pregnancy. Positive pregnancy displays a double line in the control and test band. Negative pregnancy displays a single line in the control band. Invalid pregnancy displays either a single line in the test band and none at all. This indicates that the sample being tested is invalid, wrong, or defective. After reading its result, remove and properly disregard all material and perform hand hygiene. Once you're already done with the procedure, you may let your client know its result. Document everything in the client's record and bid goodbye to the client as you finish the appointment. And that's it, a short and sweet procedure of pregnancy test. As we venture the learning of pregnancy test, I hope to give you a clear knowledge that can help you achieve that RN. Again, my name is Sabra of BSN 2-1. Goodbye and see you on the next adventure.